But this person says, I have virtually no teeth left, 1 tooth and 2 halves on the top gum and 2 teeth and 1/2 a tooth on the bottom gum due to an intense fear of dentists. Would it still be possible to get dentures?
Yeah, but they would have to see a dentist, you know. I mean, there was a post on Facebook a few weeks back, and I have to say thank you to a lot of my patients, because the post was, can anyone recommend a dentist on the island if you're terrified of dentists? And if you read down the posts, kind of virtually everyone that it's written in, they mentioned every dentist on the Isle of Man. So, you know, if you got on with your dentist, that's who they mentioned. Now, I didn't post anything on that, but the one thing I always say to people when they say to me, well, do you treat nervous patients? We say, yeah, of course we treat nervous patients. But if anyone asks me for advice, I'd say the best thing to do, though, is give any practice, ask your friends, ask your family, give the practice a ring and just say, is it possible just to have a quick chat with the dentist just when he's going for a cup of coffee, just when he's going on his lunch, not in the surgery, just in the reception? Because that way, you're not being sat in a dental chair and someone's staring down and looked upon. You know, you're either I can meet patients out in the car park. It doesn't, you know, and I'm not looking at their teeth either, because they think, well, if he's in the car park, okay, he's not looking. It's just meet the dentist, see if you get on with the dentist, and then think, okay, I didn't get on with that person. My gut feeling wasn't quite right. So then find someone else. You haven't had to pay for consultation. You haven't had to pay, you know, for a checkup. You haven't had to show them your teeth. But at least you've got a vibe. Do I like this person? Do I think, yeah, all right, I'll let this person treat me. I trust this person. I can build up a trust with this person. And that's the best way of doing it.
So this person who's texted in, you'd be quite happy to do that for them,
yeah,
and just
or
get over that
this
initial
person,
hurdle?
If this person wanted to meet me, yeah, absolutely fine, and have a look and see what we can do.
Okay. And in terms of getting dentures, is there much pain involved in that?
Dentures are quite difficult. People think, well, dentures are just pieces of plastic. They're dead simple. You put them in. You know, anyone who has dentures will tell you that they'd much rather have kept their natural teeth. The difficult thing about dentures, if you're at a party and someone's just had veneers done or crowns done, people will kind of go, what do you think of my new crowns? What do you think of my new veneers? Nobody ever takes their teeth out and goes, what do you think of my new dentures? You just wouldn't. They just don't do it. But technically, they're very difficult to make, because you're trying to fit something which is hard and either metal or hard and plastic into an area which is soft and delicate. So, you know, there are different liners we can put on a denture. There are different ways we can make the plastic. We can shine the plastic. I mean, I work with a lab up in Ramsey, and Rob up there is brilliant, you know, and he's quite happy. We arrange for my patients, they don't have to go up and see him, but we arrange for my patients to go up, and, you know, he'll chat to them and he'll have a look and he'll go, well, you need this size of tooth, or you need this colour of tooth. So he can pick the right sort of teeth for them, and then it's kind of up to me to sort of put them onto the sort of teeth, if you put them onto the denture, if you like, and then send it back to him, and he'll say to me, I don't think you're right there, Mark. You know, so I'm relying on his experience as well as my experience. So that's where the words dental team come into it, and you know, that's really good.
And that is so important, isn't it? Because your teeth change the shape of your face.
Yep. Yeah, without your teeth, everything kind of shrinks. And I mean, we're talking about dentures, but I brought a thing on implants, and obviously you can't see that, but there's some pictures. You've got one person with their teeth, and then basically after they lose their teeth, the face starts to sort of sink in, and then later on, when you start to lose teeth, you then lose bone, and that's where everything sort of caves in. You get this sunken, kind of aged appearance. So, you know, you can use dentures to bulk that area out, to give back, I wouldn't say a kind of youthful appearance, but it can make you look younger again. Just the same way you can use implants to do that.
Okay, well, I hope that has made some difference to that person listening, and, you know, if you...
Don't ever feel embarrassed, though, because we've seen it all before. I can honestly say, hand on heart, the number of times people come in and go, I've got the worst teeth you've ever seen, and only once has that ever been true. You know, for every dentist, it's only once that's true, and even if that person thinks they've got the worst teeth, if they've only got 6 teeth left, and hand on heart, I've seen patients with worse teeth than that.
Okay, I
Worth
do hope
mentioning
that is some help. Just give us the Abbey Dental details.
You're going to go, okay. See, I knew you were going to catch me out. The phone number. The phone number is 823040. And the website, because I had to memorize this because I was told off so many times last time, is www.abbeydental.info.